Our goal is to find a way to break down barriers to healthcare that exist within our communities. As we have worked through this proposal as a team, it became very clear that Andrews Elementary was a great place to start. The reason being is that, as many of you know, Andrews Elementary has a very large student population, and it is a very high-need area that is low resource, which means that our parents and our children struggle with things that some of us take for granted, such as if a child gets sick in Ms. Watford's school, if you want to see a pediatrician, I'm 20 to 30 minutes away. Your parent who might work shift work will have to leave that job, leave money on the table, and maybe even try to call a cab or find a way to get there because you may not have transportation. So many things that having boots on the ground in a health center that's located in the school could easily address. The great thing is that we are a federally qualified health center, which means that we do receive federal dollars in order to go out and serve the community in places that might necessarily be profitable. So this is not an endeavor that we think will be lucrative to anyone's pocket. What it's going to be lucrative for is our community. What it's going to benefit is those children and families who are not getting health care services because they cannot make it to us.
I'm very excited about the possibility of this for our community in Andrews, for our families, and for our students, because we do serve a very large population, and we do have a high need in our community for this. With our school being very large, this would not only help meet the needs of those students, but it would also assist us with our nurse at our school as well. Our nurse's office stays quite busy at Andrews Elementary. On a typical day, she sees between 25 to 30 students in the health room for complaints or sick visits, and during the months of November through March, that usually doubles.